Good day, and welcome to another edition of Living Well with Adina. My name is Dr. Gataka, and I'll serve as your host today. We are thankful that you're joining us. Several weeks ago in November, we provided a town hall as a COVID update to the communities that we serve. This will be a springboard and add more information, hopefully that you'll find valuable, particularly in helping us join the fight in battling this COVID epidemic. We look a little different today. Normally, we broadcast from the PACCAR Medical Education Center located on the campus of the Adina Regional Medical Center in Chillicothe, Ohio. The pandemic, like many of you, has affected us as well, and we've needed to make adjustments. So we're using this different format from different various locations throughout Chillicothe and beyond to be able to provide this for you. We still want to hear from you and want to have your feedback. So we want to, if you have questions or concerns, by all means, please enter them into the box below. We have staff on hand ready to answer those questions for you. Without further ado, I'd like to introduce our esteemed guest today. Joining me today is Kathy Edrington. She has her doctorate in nursing and she serves as the Chief Operating Officer for Adina Health System. Welcome aboard, Kathy.
Thank you.
Joining us today as well is Garrett Guillozet, who serves as the Commissioner for the Ross County Health Department. Thank you very much, Commissioner, for joining us.
Thank you for having me today.
We appreciate the partnership that we have with the health departments throughout the 9 counties that we serve. Also joining us today are 2 new guests that to our show. The first one is Molly Grooms. She is the Chief Nursing Officer for Adina Health System. Hi, Molly.
Good afternoon.
Thank you for joining us. And then we're also joined by Jackie Redmond, who serves as the Director for Specialty Services. Welcome on board, Jackie.
Thank you for having me.
Yeah, I appreciate all of you. We'll spend the next few minutes here really kind of going through lots of information. I'd like to start off first with you, Kathy, though. Boy, the nation, the state, and many others, including us, have experienced a lot of record cases associated with COVID. Can you tell us a little bit about how that's affected the Adina Health System, both the hospitals and the urgent cares and other areas that we provide services?
Yeah, so thank you again for having me on today and this opportunity. It's kind of just unbelievable what we've seen over these last several months. Lots and lots of patients that need to be seen, lots of care that we need to provide, both from a COVID perspective and a non-COVID perspective. So we have really, really focused on how do we do that hospital within a hospital concept. After the first couple of months where we didn't see that enormous surge that we all thought was going to happen in the beginning, we had time to plan within our incident command on how we're going to handle this virus and how we're going to take care of folks with the virus as well as take care of our community for their other healthcare needs. So of late, we've had some pretty high volumes. Adina's seen its highest volumes in the last couple weeks, upwards of about 60 COVID patients. And so that's a lot. And so we've had to be extremely creative and nimble, both with our staffing and our space to make sure that we're able to take care of those patients and keep our operations open.
So, Kathy, you mentioned you're up to the Adina Health System's up to 60 COVID patients. Isn't it true just a few weeks ago we had the capability of doing 20? What were some of the things that you did to get us to 60, and what were some of the adjustments that you and the hardworking staff had to do?
Yeah, lots of creativity. Space, we've talked a lot on Facebook Live about that and what that looks like for the health system. So we've developed all these different surge opportunities. And as the volumes have gone up, we've pulled different, hats up. It's like, what are we going to do next? So we have been very, very nimble. And so as the census goes up, we say, okay, let's pull this next trigger and go into this next space. So we've utilized our critical access hospitals, which has been great. Greenfield and Pike have been wonderful to work with. They have stood up places where we can put our COVID patients and again, not only take care of COVID patients, but other patients. And again, the PACCAR, we've used our urgent cares. We even have OOP boxes, which have gone into place in the last week. From the health system's perspective, that allows for us to actually test our patients without having a bunch of people come into some of the centers. So just really a lot of creativity.
You mentioned the Oot box, Kathy. Perhaps you could tell us a little bit more about that. I was driving down the street, heading west on Western Avenue, and it's literally it looked like this little box with a window. So how did you discover the concept of Oot boxes, and what did you have to do to get them here, and how are they manned?
Well, it's interesting. I mean, you've probably even seen a form of Oot boxes even at restaurants and stuff as they're doing outdoor delivery. I think even here in Chillicothe, I've seen them. So we decided that having this opportunity would really help with the flow. And so these Oot boxes allow our caregivers to not have to stay within the proper space that they're in. So if they're in an urgent care, they don't have to stay within that four walls. They can come into the Oot box. The Oot box allows for them to do testing. It has electricity. It's got all of their IT supplies. They can do whatever they need to do in that testing. And in the inclement weather, they can be in that Oot box. So it's not like they're standing outside. When this all started, I think across the country, you saw, how are we doing testing outside? How are we doing drive-up testing and all of this? So the Oot boxes have been a huge add to the health system because it allows for our caregivers to have some comfort of that warmth or the air conditioning as it gets hot. And it's got all of the resources that they need in that space.
So taking to the account the patient comfort and experience as well.
Yeah.
At the top of the show, I mentioned that we're having high volumes, but that's true everywhere, including Columbus and surrounding areas. So in the past, we may have been able to rely on, I guess for lack of a better word, safety net, if we were to become full and needed to transport patients elsewhere. That safety net really has dissolved with all of our partners in the region also filling up. So I think that you and the team have developed something called Adina at Home to help with managing patients. Can you just tell us a little bit more about what that means and what kind of patient expect if they're offered an Adina at Home possibility?
Absolutely. So Adina at Home, the concept of this is if our patients are able to go home and have the appropriate monitoring and the appropriate care from home. So somewhat of a telehealth, right? You're able to monitor and be in the comfort of your own home while you have your illness. That is what the concept is. And what's really interesting is we got this concept from another health system. I always tell my leaders that it benefits us so much to have great networking across other health systems because people have just the most amazing ideas. And so I had a contact up in North Dakota that had done this kind of concept, and they had great success because they were seeing huge volumes. And just of late, we've had 22 patients in our Adina at Home program, which in the past would have likely been in inpatient beds within our facility. And so this allows for patients to get the care from the comfort of their home with the expertise that's needed. So you still have nursing staff and physicians who are taking care of you, along with great equipment to keep you monitored and healthy while you're at home. And it keeps us from having to crunch people into beds within the health system where, we're running out of space. So that's just one of the examples of the innovation and the creativity that we've been able to put into place with all these triggers as the census continues to climb.
Thank you for sharing that with us, Kathy. We appreciate you. Jackie, I'm going to turn my attention to you next. Kathy's just described some great programs that we have and technologies that we're deploying in the home and Oot boxes that are able to be deployed and placed in the community. Behind all the technology, however, there are staff. We call them caregivers here at Adina. Can you tell us how the staff are doing? How are they holding up?
Well, they're tired. Honestly, they're exhausted, but they're so resilient. I'm so proud of them. They've stepped up in so many ways. I think about all of the things that they've endured. They've been involved in several critical situations with patients and just always rise above. They're out there on the front lines working hard, always giving us suggestions of ways we can do things better for our patients. They step up and have picked up extra shifts, as we talked about, staffing being challenged. And, then they're also substituting as the family because oftentimes these patients, they're not able to have visitors because of their isolation precautions. And so you see them holding the hands of the patients, or just being there for a patient who might be scared and lonely. When you talk to them, even though they're exhausted, they're ready to step up. They're fearless, always about the next challenge and how can we do things to serve our patients. But it's not just the frontline nurses too. Every day I get calls from ancillary staff or people in the AMG clinic or other staff asking how, when, where can we come and help, really wanting to roll up and do what they can to help our caregivers. It just warms my heart so much because, we're really, even though this journey, it's exhausting, it's physically, it's mentally taxing. Our staff are really, they're willing to live out our mission of being called to serve, and we're going to do it and continue to do it and fight this fight until the end. So proud of them. I'm proud to be an Adina caregiver and everything that our staff have done so far.
We're around the holiday season. Christmas is just next week. How's your staff preparing to gear up to take care of patients over Christmas?
Well, we've talked a little bit about some of the staffing deployment that we've had. We've brought in some extra caregivers to help, try to battle this high census that we're facing, but also to potentially give our staff some respite care. They've worked really hard, picking up extra shifts, long hours, staying late. So, we're really we take it day by day. We look at our census triggers and we know what we need for staffing, and we do whatever it takes to roll up our sleeves and give our patients the very best care, whether it's Christmas, whether it's a Monday. We're here to serve all the time.
Thank you, Jackie. Molly, Jackie brings up a great point. I think, Molly, you and the team, along with Kathy, were very forward-thinking, looking ahead many weeks ago, actually, in planning for some of the nursing staff issues that you might be having. Tell our viewers a little bit about what you've done from a chief nursing officer perspective and the health system perspective to get more help to take care of our patients.
Sure. Well, we've seen in this phase of the pandemic that really nursing staff have been a limiting factor, not only because we're taking care of more and more patients, but also because just like with community spread, our nursing staff are very much part of that and have become sick themselves. So in partnering with Human Resources, we were able to engage in a rapid staffing, rapid deployment agency to be able to quickly bring on a variety of staff. Our first deployment of that staff was actually November 30th. We meet with them a couple times a week to discuss what our needs are, what we're seeing. And through that constant evaluation, we're able to bring on weekly on Mondays a variety of staff to meet our needs. They're serving in different areas of the hospital and throughout the system. So these are registered nurses that are able to work in a variety of our sites to support our current staff. And then of course we've created more beds too. So they're taking care of the more and more patients as they come in to receive treatment.
Thank you, Molly. You mentioned you've created more beds. How many more beds have you been able to produce to be able to meet the rising demand?
Sure. So on several of our units, we added 10 more beds each. So on our existing units, about 25 beds. We do have a clinical decision unit in the emergency room that we use for a variety of things throughout the year. Most recently, it's been taking care of any of our COVID patient overflows. And then also, while, as Kathy mentioned, we're utilizing our critical access hospitals, they've pretty much doubled their inpatient census. So while those beds have always been there, we're actually filling those beds with patients. So of course, that requires more staff to do so as well.
And that's in Greenfield and Waverly, correct?
Yes.
Awesome. Thank you, Molly. I appreciate that. We're going to turn our attention now to the Commissioner. Commissioner, thank you once again for joining us, taking time out of your very busy day. I know that the health districts, you as well, have pressed on the gas sometime in February or March and have not let up. The vaccines have been released. The one from Pfizer we know has been in the headlines and has started to distribute. It's a question that we're getting almost every day at the health system from physicians. Our physicians are getting those questions as well as staff. I'm sure those that are listening out there want to hear more about locally. Tell us more about what you know from a vaccine perspective from the health district.
Sure. So again, thank you for having me on today. We do have a great partnership, and I know the health district appreciates the health system and all of your staff who have been working tirelessly throughout this pandemic. So we do know that there is a light at the end of the tunnel. It is nearing, but we still have a long way to go. So last week, Pfizer did receive an emergency use authorization for their vaccine, which is great news. Tentatively, hopefully today, Moderna will also receive an EUA for approval for their vaccine. So these are two separate vaccines that are being or have been or will be distributed, I should say, starting this week and throughout the coming months. The Pfizer dose is a 0.3 milliliter IM injection. It requires dilution. So a lot of hospitals have been predispositioned across the country to receive this particular vaccine. It requires ultra cold storage, which is sort of an unusual requirement for local health departments, as most of us don't have that ultra cold storage for vaccine capacity. Because of that requirement, most health departments across the country and in Ohio will be receiving the Moderna vaccine when it's approved. This vaccine can be stored at refrigeration temperatures and has a longer shelf life than the Pfizer vaccine, both of which are about the same percent efficacy, so that's great news. So it's between 94 and 96% efficacious. So we are looking forward to getting the vaccine in. We are tentatively scheduled to receive doses starting next week, pending the Moderna approval by the FDA and CDC.
So as early as next week, Commissioner, you'll be getting those doses. So the question I'm sure a lot of folks have is, how do you know when you can get the dose? There will probably be more people that want it initially than there are doses available. Talk to us a little bit about how the health district and health districts in the other areas as well will be determining who gets what and when.
So we've worked really hard with the state and the governor's office to prioritize populations based on risk of exposure. So healthcare providers who are unable to get the vaccine from their health system or their offices are in the priority 1A group. Additionally, there are several other providers, EMS providers, people who live in long-term care facilities, residents of long-term care facilities, those sort of individuals who have a higher risk of day-to-day exposure of COVID-19 are in priority group 1A. That's really where we're focusing our time and energy at this point. Our plan is to dispense the vaccine here internally at the health district, utilizing pre-registration of those priority groups. And we have already started to pre-register them here to be able to get that vaccine.
Any idea, Commissioner, I know this is a difficult question, any idea when the average citizen or the general public can expect that they will have vaccines open up to them?
We're fully anticipating that the general population should be able to get a vaccine late spring. It depends on a lot of factors. How many people take the vaccine, the first priority groups, what's left, how quick other vaccine manufacturers can get approved by the FDA and CDC, and then general manufacturing capacity. So there's a lot of sort of moving parts, but by late spring, we hope that the general population can begin to get vaccinated.
All right, thank you, Commissioner. Kathy, a question to you. We know, has Adena received notification about when they will receive vaccines, and what is the health system doing to gear up for the vaccination of its employees?
So we've been actually planning for vaccination since the beginning, which is great. We do believe that we will get vaccines next week. And we will get our first round of those vaccines. And we have already prioritized who will get those vaccines first based on those that are of the greatest risk, those that are taking care of patients at the front line. And so we fully anticipate that next week we're going to be able to give our first doses.
Just so that I think our audience understands, Adena for now will be just receiving vaccines for its employees at this time.
That is correct. That is correct.
All right, thank you very much. Turning my time back now to you, Commissioner. You mentioned about the priority. Tell us about what kind of manpower this is going to take on your end, and how has your staff been handling and gearing up for the vaccines? What have they been doing?
So we've had vaccination plans in place really since after 2011. That's when emergency preparedness really involved local public health. So we have been preparing for a pandemic like this to make sure that we have strategies and processes in place to really get vaccines or pills to people depending on the situation. So we've practiced this. We've practiced our point of dispensing. So we've really got it fine-tuned. We are bringing on more staff. It's a unique situation for local health departments because while we are also responsible for vaccinating some of these priority populations and then eventually the general public, we also have to maintain the other critical aspect of this pandemic, which is contact tracing and case investigations. So we will be moving into a dual role of doing both of those. So we have delineated staff to work on vaccination and then staff to work on case investigations and contact tracing.
There's a question coming in from a viewer. Should they be concerned at all about getting the vaccine?
No, there's a lot of misinformation and myths around the vaccine. A lot of misinformation on, wow, this was quickly created, it was rushed through. The reality is that the last time we've really came up with a vaccine like this was for H1N1, and that was in 2008 and 2009. Just the sheer advancement in technology has allowed us to really speed up the process of this vaccine development. Additionally, coronaviruses, we know a lot about coronaviruses. This one is new and unique, but it is still very similar to existing coronaviruses. So scientists have been able to really apply what we've already known into the process of creating this vaccine.
Thank you. Thank you for helping answer that question. Jackie, asking you this next question. So we do know, and we've heard both from Kathy and the commissioner here, that there's going to be a limited supply of vaccine first, and there is a priority that has been developed for those vaccines to be distributed. So what are some things that we all can still do? Remind us again, until everyone's vaccinated or we get a large proportion of the population vaccinated, remind us of what we can do to keep each other safe?
Well, I think one thing that's really important, we have the holidays coming up, and I know it's tempting. It's tempting for everyone wanting to be with their families and gather in large groups. So I think the one important thing to emphasize with that is if you can help it, try to limit your gatherings with the people who are in your household. And I know sometimes that's not possible. So, you still need to exercise all of those things that we've been telling you to do for months. So washing your hands for 20 seconds at a time. As often as possible throughout the day. If you can't wash your hands, using the hand sanitizer, one that has about 70% alcohol in it, those are the best ones to use. Wear a mask. Can't emphasize that enough. Just, keeping your face covered and keeping safe distance of people 6 feet away. So anytime that you can do that, that's really important too. If you're coughing, if you're sneezing, using your elbow or a tissue. And really the most important thing that we can say is stay home if you're sick. I know we have things to do, our lives carry on, but it's really important right now to slow the spread to make sure that you stay home when you're sick.
Thank you, Jackie. Jackie mentioned masks, Commissioner. And so can you kind of walk us through, for those who may still have questions about mask wearing, and I think we have a little graphic here to kind of walk us through that. But if you can just tell us kind of, from a perspective from a health district, why do we wear the masks?
Well, masking is extremely important to continue to reduce the spread of COVID-19. We know that COVID-19 is spread via respiratory droplets. And so the more people we have wearing masks when we are within that 6 foot of distance, we are greatly able to reduce the risk of transmitting COVID-19 to other individuals. So it prevents us from spreading COVID-19. This is a disease that you may have it and you may not know you have it. There are a lot of individuals that we've encountered throughout our case investigations that are asymptomatic. So they have COVID, but they are completely unaware that they have it. So wearing that mask really reduces the likelihood of transmitting the virus to other individuals. Additionally, there's been some new science recently that has said that the mask provides a filtration for us to actually add an additional barrier or a tool to reduce infection of ourselves if we come in contact with another individual.
I'll add too, Commissioner, that it's important that if you're using a disposable mask, change those out frequently. And if you're using a washable mask, make sure we wash those. The mask doesn't do well if it's been on for 14 days or so. So thank you. Now, Commissioner, some folks may not have the ability to get some of those masks easily. I do know that you've been working very closely with the Chillicothe Mayor, Luke Feeney, and the COVID-19 community response team. I believe there are some areas or locations within the community that provide masks. Can you kind of review that with us for the viewers that might need to access some of those locations?
Absolutely. We do have a partnership with the City of Chillicothe and a mask work group. They are available throughout the county on an as-needed, first-come, first-served basis. Masks are available at the Ross County Public Library branches, the Community Action Agency, the United Way of Ross County, the City of Chillicothe Administration Building, as well as the Huntington Township Fire Department. So a wide variety of locations across the county where masks can be obtained for free.
And no appointments necessary, is that correct, Commissioner?
That's correct.
And while supplies last,
And we are currently working on increasing supply. We have some masks that we're receiving from the EMA as well as volunteers creating those face coverings. So we are always ongoing increasing our capacity.
Thank you so much. And thanks for partnering as well with local government agencies and others to provide those necessary masks that we can keep ourselves safe as well as protect others. Molly, I'll ask you this question. What if someone thinks that they're sick and think they might have coronavirus, what steps can that person or individual take?
Sure. One of the first things we're going to ask you to do is call our COVID hotline. With that, you'll be asked a series of questions that we can help direct you to best get the care that you need. We have a couple urgent and primary care locations where testing can be done. And once again, the operators on that hotline can direct you to a location that's close to you and based on wait times too. It's important to note that if you're having serious symptoms, you should head to the emergency department, such as having difficulty breathing, chest pain or pressure, if your lips or face become blue, if you have sudden confusion, please don't hesitate to seek emergency care in the emergency department.
Thanks for reviewing that with us, Molly. We appreciate you as well. So this might be a good time for me to remind the viewers or to alert the viewers if you haven't seen it. Adina really wants to partner with other agencies and want to make sure that we get the message out to the public regarding what levels that we're in. Most of you already know that the state of Ohio has come up with an alert system that helps you become more aware of how prevalent and how risky it is to have COVID within the community. And it is a yellow, orange, red, and purple coloring for counties. And we have set up a system for our digital bulletin boards as well as social media and our other ability to communicate with you to remind you what level that you're in, to provide you that ability. We're going to finish up the program here in just a couple of moments. Before I do, I wanted to ask Molly if you have any last minute thoughts or questions regarding folks who might be concerned about coming into the hospital for needed services.
Sure. No, I think what I would like to encourage you to do is if you need our services, please don't hesitate to come in. We have been preparing for this. We have space for you. We have trained staff. And I would like to also just say that, our staff are very much ready and really engaged in taking care of our community during this time. Those quality things that we do the rest of the year are still very much in full force. We're maintaining all of those different programs as far as hand washing, hand hygiene compliance, looking at the different quality metrics that we track throughout the year. So that's very much in play. So like the flu, like any other kind of seasonal thing that we're seeing, we're very much prepared and ready to take care of you.
And Jackie, what would you like to say to your fellow caregivers and all the staff that's working effortlessly during this time?
I just thank you from the bottom of my heart, from our community's heart. We just appreciate them so much. I don't know that there's any words that could describe how much we appreciate what they're doing. Even though they're tired, we just appreciate them so much.
Yeah, thank you, Jackie. We indeed do. Commissioner from the Health Department, or Health District, any parting words?
Continue to do what we've been saying to do for months now. Maintain your social distance. Don't gather with people outside of your household. Wear your face coverings, and really, limit your travel as much as possible through this holiday season. We know that these are not easy things to ask the community to keep doing time and time again, but we do know that when we take part in these actions, it does reduce the burden on our health system capacity. It helps with staffing issues, and it really does help keep us safe as a community. So please continue to be mindful of that as we approach the holiday season.
Thank you, Commissioner. And Kathy, I'll give you the last word. Your parting advice or thoughts from being the Chief Operating Officer from Adena Health System.
I just want to thank you guys for allowing us to come on and talk today. It's just great to be able to connect with the community and talk about this pandemic and what we're experiencing. I just want to reiterate that Adena is here for you. We are here to take care of you. We are called to serve, and we are here for this community. So I want to make sure everyone understands that it is safe to come here. Yes, we have this pandemic that we're working through, but it is safe to come here and have your services. But also, I just want to reiterate the importance of all of the things we've been saying for months. Again, please wear your mask, please wash your hands, please socially distance, please be careful. Our healthcare providers, they're tired, they're really tired. And we want to make sure that we all stay healthy so that we can give the proper care that we love to give every day at Adena Health System. So, really, we just hope that all of you will have a very, very safe holiday, and you will do all these practices and try to keep down those big gatherings, because we do anticipate that we could see another surge following the holidays here coming up in the next couple weeks. And I also want to reiterate what Jackie said and just thank all of our healthcare workers. They are working so hard and they are so tired and they are doing such a phenomenal job. So I just want to thank everyone for all their hard work.
Thank you, Kathy, and thank you also to all of our panelists for taking time out of your very busy day. We're very appreciative of all the work that you're doing. And more importantly, thank you to the viewers. Thank you for taking time out of your day to listen to these experts and to listen to what they have to offer. We do wish all of you a very safe, happy holidays. We will see you once again on another edition of Living Well with Adena that will be on Thursday, January 7th at noon. Thank you so much.